Hi and welcome back to Conceptual ObGyn. Today Dr. Aditya of course, I'm going to be discussing probably the most important topic that I have discussed over all other reels until now. By the way, all the reels that I've made are available exclusively for subscribers on our app, so do check them out. What's going to be today's topic? So today I'm going to be taking a two video series of which the first session that is releasing today is going to talk about several suture materials that we have in our obstetric and gynecology theater. What am I going to be discussing today? So the sutures for today for the first part of the video are going to be the most favorite and the most used Vicryl, Vicryl Plus, Rapid Vicryl, Silk sutures, Merisilk, Silk, and a very nice one of my favorites and what was also the topic of my thesis, which happens to be the stapler. So it would just be unfair on the suture material that I have used throughout my residency. My almost entirety of residency has gone in using one suture, and not just residency, even my subsequent practice, and it is just fair that I decide to start using it with that. To add a bit of importance and fun element to it, I am also going to be rating each and every suture material as per its usefulness and utility to me as an obstetrician and a gynecologist. So the first one happens to be Vicryl. But before I begin, I would like to tell you all that whenever you all look at any of these suture material packets, there are a few things that are given. Now there are multiple companies. The most common company that we use happens to be this. This is the classic Ethicon company's Vicryl. This is of another company. So just to give you an overview as to what all is written on these what do I say, suture packets, I'm just going to use a standard example. This is a Vicryl Plus. I'll be talking about it subsequently. So first of all, you see that over here the name of the suture is written. For you it might just be looking inverted, so please excuse that. So the name of the suture is written over here. Above that, in the US gauge system, how thin is my thread, my suture thread is given over here. So over here it is, you can see 3-0, or what we also call as 30. So you can consider that to be something like decimal and 3 zeros. So it is that thin. The other side, if I'm going to talk about any other suture, then let's see, what do I have over here in comparison. This happens to be um, rapid Vicryl. So over here you can see it is just single zero, so this is 1-0. Or if I'm to talk about any other suture, then what do I have? This happens to be on the US gauging system number 1. You can see over here it is just 1. So 1 equals 1.0, whereas the other sutures equal 0 point something. So obviously when you have a whole number that is given, that is just 1, 2 or 3, and there is no 0 next to it or adjacent to it, it means that it's a much thicker suture. So number 2 is going to be much more thicker. The thread is going to be much more thicker than number 1. Similarly, 2-0 is going to be much more thinner than 1-0. So basically in the center you have 1-0, and then you become thicker from 1, 2, 3, 4 and so on, and you become thinner from 1-0, 2-0, 3-0, 4-0 and so on. So that is how you determine how thin is your thread, and accordingly as the thread keeps getting thinner, even the needle length keeps getting shorter. But that is not important. This US gauge that I just showed you happens to be important for determining the thread diameter. Apart from that, what else do I have over here? In the second line, you can see that they've written absorbable and surgical suture. So of course, and US pharmacopoeia. So of course it is a absorbable. It is an absorbable type of suture. We all know that Vicryl is. Secondly, Vicryl Plus it is given. So Vicryl Plus is of course the brand name that Ethicon has given to it. Why is it plus? It is given in the second line. They have mentioned that it is antibacterial coated. So this is coated with triclosan. I'll be talking about it subsequently. Below that, you can see that there is 70 centimeters that is written. The 70 centimeters corresponds to the length of the thread, that is given inside. Whereas if you see over here, they have also given the needle. They have given the diagram of a needle, if you can see very well. Yeah, over here, yeah, I think you can see now. So when I talk about this thread, you can see that in between they have mentioned 20 millimeters. So the length of this needle, not the thread, the needle is 20 millimeters, which is 2 centimeters, whereas 70 centimeters is going to be the length of the thread. Apart from that, if you look at this needle again, you see that they have given what type it is. It looks round, so that's a round body needle, which is hence it is very useful for taking sutures through the uterus. And the tip is tapering, so it is also called as a tapering tip. You can see the tip tapers off, so it is also called as taper tip, and it's half a circle. If you see, if you make an entire circle, then this is an exact semicircle. On the other hand, if I'm going to see any other suture, then let me see what else variation do I have. I have mostly half a circle. Okay, so over here I have another thing that I'm going to be discussing in the second session. This is monocryl. So in monocryl, you see that it is 3 by 8 of a circle. So if you see at this circle, it is much smaller a circle than this one. So basically this is 3 by 8 of a circle, whereas this is half a circle. So they also mention how the shape of the needle is going to be. Apart from that, the company name is given over here. Over here they have written the manufacturing date and when does it expire, and it is manufactured by Johnson and Johnson in India. Apart from that, what is the price of this? The price of this, at least the MRP, now you might just take it in bulk and you might have a lower price. The price of this is 619 rupees. This is 619, so somewhere around 600 to 650 of the company Ethicon. So the first suture that I'm going to be unpacking in front of you is going to be this classic ethylone. Now, classic Vicryl. So Vicryl, what is it? Over here you can see that they have mentioned the name. The name is polyglycolic acid. So Vicryl is one of the brand names that is given. Similarly, this is from another brand and it is called as iCall. iCall brand यहाँ पे दिया हुआ है. So never call it Vicryl. I would prefer it if you call it polyglycolic acid 910. That is the actual name. So whenever I'm talking about any suture, there are three main things that you have to describe whenever you're talking about it in your exams. The first is going to be, is it a natural or synthetic? This, of course, I know is a synthetic suture. If I'm going to talk about natural, then something like a merisilk is a natural suture, whereas this is a synthetic suture. I have produced it. It is not made from any animal or any tree or something. Next, given that it is a synthetic suture, that is the first point. The second point is going to be whether it is absorbable or non-absorbable. So Vicryl is a classically absorbable, or to be more specific, delayed absorbable suture. And the third thing is going to be whether it is braided or it is monofilament, or I even prefer to call it multifilament or monofilament. So classically Vicryl is going to be multifilament. Over here you can see that they have also given it is braided. You can see over here it is written it is braided. Braided is basically the way choti बांधते हैं लड़की लोग स्कूल में बांधते हैं. So that is called as braiding. So that is these are the three characteristics that you have to mention for any suture. For example, if I'm going to talk about something in the next session, if it is a monocryl suture, then monocryl again is going to be a synthetic but a monofilament absorbable suture, whereas this is a multifilament or a braided a synthetic absorbable or delayed absorbable suture. So three important points for all sutures constant रखना है. You give this start to your examiner whenever you're given a suture material. Be assured that it is going to be a good viva. So yeah, so this is the first suture that I have, and now I'm going to be opening it up. I'm going to be opening it, and when I open it, inside this, it is going to be kept like this. Your suture material is going to be like this. So when I open this more, of course, this is going to be done in the OT. You see that the needle is given over here. You can see that the needle size, if it is visible, yeah, it is visible. It is half. It is half a circle. I'm going to remove it, and I have removed this. So the length that they have given for this is 90 centimeters. The Vicryl Plus was 70, but this is 90. Now if you see it much more closely, I don't know if you're able to appreciate. I don't know how can I make you appreciate, but if you'll see it very well, this is a braided suture. So it has braids on it. It has बेसिकली इसका चोटी बांधा है, एक दूसरे के थ्रेड को एक दूसरे को बांधा हुआ है. Now what is the advantage of this braiding? First of all, multi-filament sutures are very strong. They won't break. You see, I'm using all my strength. It is not going to break. It is very similar to the story that you read in your childhood of when multiple sticks are kept together, you cannot break them. Which is why this braiding or this monofilament, this multi-filament that suture this is made of is going to give it a lot of strength. If I'm going to objectively tell you how much of strength, then you have to know that it loses 75% of its strength by around 5 to 6 weeks, whereas 50% strength, which is much more an important criteria, is at around 3 weeks. all in all, it is going to get absorbed within 50 to 70 days. So I'll say it takes around 10 weeks for this to completely get absorbed. How is the absorption? Of course, by hydrolysis and the local enzymes. But now because this contains these breads, if you see, अभी वो जो चोटी तुम लोग बांधते हो उसके बीच में ना छोटा छोटा गैप रहता है. ये छोटा छोटा जो गैप रहता है उसके बीच में बेसिकली जो ऐसे करते हैं तो ये जो इधर गैप आता है बीच में, ये जो बीच में ऐसा गैप आएगा, और दिस place where you can see this place in between over here, this place in between, on this there can be, or it can prove to be, a nidus or a site for infection where an infection can come in and it can settle on it. So when it settles on it, then because this is a material that can absorb water and fluids, and through capillary action the entire infection can go through this. So basically if you have used a suture between two layers, then the inner infection can come outside or the outer infection can go inside, which is why this is not a great suture whenever the site is having any infection. Very important to remember that. This is also called as wicking, W-I-C-K-I-N-G. Wicking is basically when the suture material is allowing all the fluids, all the infectious agents to flow through it due to capillary action. And this is one of the biggest disadvantages of Vicryl. Apart from that, a very strong suture, delayed absorbable, which is why my main window of post LSCS uterine closure, which takes around 1 to 2 weeks to heal, it is going to help come through it, tide through it, which is why 70 days is an excellent time frame for that. Where else do I use it? In obstetrics, I also use it. I preferably use this for episiotomy suturing, or if there are any vaginal tears. We use it thoroughly in our hysterectomies, vaginal hysterectomies, abdominal hysterectomies. In fact, even in laparoscopic hysterectomy for endosuturing of your vaginal vault, this is an excellent suture material and is used. In gynae, where else? I am also using it for multi-layer closure of a myomectomy scar. So another important place where I'll be using it. Where do I not use it? I preferably do not use it on the skin. The reason I do not use this on the skin is of course because that can lead to skin infections, and the rising in skin infections can of course lead to wound adhesions. All in all, excellent suture. This is in fact the standard suture through which I can compare all other sutures. I have used it extensively. I have no complaints with this suture. Maybe the infectious part is something that doesn't help it get a perfect score, but in my opinion, I'll be giving this a good 9 out of 10. Excellent suture, my favorite. What did I say? Where did it lose its marks? It lost its marks because it was not able to prevent infection. So what we came up with was this Vicryl Plus. This Vicryl Plus is coated with triclosan. So triclosan, I'm not going to open it because it looks very similar. So triclosan is going to be a broad spectrum antibacterial agent that is coated all along it, which prevents the infectious part of it, which hence makes it even better. So I'll be giving this Vicryl Plus a 9.5. Why a 9.5? Because the rate increases slightly because of the triclosan coating, which is why I'm not able to give it that perfect 10 on 10 rating. Of course, in science, you can never be giving a full marks for anything. So 9.5 out of 10. Excellent two sutures. In fact, we use this very often when we can get it in our wards. A few people said that we understand that your uterus is taking 2 weeks, 3 weeks to heal, so the half-life of what, 70, not half-life, the total life of 50 to 70 days is justified. But what about the episiotomy? That episiotomy heals within a week, maximum 2 weeks. Why should the suture be there for so long? It is going to cause dyspareunia. It is going to cause local discomfort. The patient is going to tell me that there's a pricking kind of a pain in the perineum whenever she sits. That is why we decided to come up with something called as Vicryl Rapid, or over here you can also call it True Synth Fast. So Vicryl Rapid is the name of the Ethicon one, whereas this is another brand. What we did was we decided to radiate it or pass it through gamma radiation. That gamma radiation made it much more amenable to hydrolysis, and when I said much more amenable to hydrolysis, it can get its 50% strength lost within 5 to 6 days. So technically within 2 to 3 weeks it will be completely absorbed. Very ideal suture for vaginal suturing, but of course not ideal for doing your uterine suturing. So yes, I have spoken about 3 important types of Vicryl. They happen to be my classic Vicryl, which is this, which was this. Then I spoke about my rapid Vicryl, which is radiated with gamma radiation, and lastly I have my Vicryl plus. Good 3 sutures, very useful. I'll be rating this suture which I just showed you last, rapid vicryl, at around 8 on 10 because it is only good for suturing my episiotomy and vaginal sutures, vaginal laceration. So now the next two sutures that I have happen to be having a very similar name, so a lot of people get confused, and they happen to be Mersilk, and over here you have Merceline. Remember, Mersilk and Merceline, they are two different things, completely different, worlds apart. So I'll just start with I'll just start with Mersilk. So Mersilk, as the name suggests, is going to have it is going to contain silk. Now silk, this suture, the three descriptive ways that I've told you, it happens to be, most importantly, you have to remember, it is almost non-absorbable because it loses 50% of its strength only after a year and a half. So technically it is going to stay in you for 3 to 4 years aram se. Secondly, it is multifilament and it is natural, it is derived from silk. If I talk about it, then it is given the same things are given over here. So this happens to be over here a half needle, 30 needle is going to be the size. It is again round body, and the length of the suture, this is of course 0 number, that is the one that have been given, and yeah, so this is a 90 centimeter needle. So when I open this, you see that it looks like this. It looks brown to black in color, and of course it is looking very similar to vicryl, except that the color is brown to black. Now remember, they have given these classical color codings so that you do not mix these colors, and you can just look at the suture material, and even if you don't have the packet around you, you can still recognize them. So the color coding is very important. So this is hardly used anymore, given that it stays in that place for a long time, and that can not be a great feature to have the suture staying there, because it will lead to foreign body granuloma, tissue granuloma. Hence you do not use it. Earlier it was used prolifically until vicryl was introduced, so this doesn't find too many uses right now. So this was Mersilk. I would want to give it 5 out of 10 purely to respect its heritage. The next one that I have happens to be Merceline tape. So this Merceline tape, when I open it, you would see that this Merceline, I'll just show you, it is not coming out, it is not wanting to come out. So yeah, I have, oh, it is just not coming out. Please man, just come out. Oh, thankfully it came out. Yeah. So now you see that this is a very different looking, this is a very different kind of a tape. You see, it's a tape. This is not a suture material, and we have not attached any needle to it. It doesn't have any needle of its own. This is all that we had. So this is Merceline tape. It is a coated tape with silicone so that I can easily flow it through the tissues. And secondly, very important to note that this is an artificial or synthetic multifilament permanent suture. This is made up of polyester, and polyester of course is a non-biodegradable material. It stays inside you. Where is it used for? It is used for all the sling surgeries and the cerclages. So Shirodka's cerclage, abdominal cerclage, your cervicopexies, Shirodka's and Purandares especially, you will be using this Merceline tape. So for prolapse, young patients with prolapse, to pull the uterus up. And secondly, for your cerclage, of course, if there is a history of premature birth, premature labor, or history of spontaneous second trimester abortion, in those cases you are going to find this very important. So this is Merceline tape, very useful in contemporary world, very much used. This is even used laparoscopically for sacrocolpopexy and also for all the sling procedures. So as I mentioned, Shirodkar and Purandare's cervicopexy, very important, and I would want to give it, it is a little difficult to handle this one, but because of its relevance, I'm going to give it a good 7 on 10. A very big disadvantage is if it reaches your skin surface, or if it just passes near your vaginal surface, then you might end up having an erosion, and that erosion can be very painful. It can lead to chronic discharge, so, and also granuloma in that region. So I do not want that. A good thing is that because it is coated with silicone, once it gets encysted with the fibrotic tissue, it is not going to lead to any foreign body granuloma, unlike this other silk suture. So this was Merceline tape permanent suture. So that is it from today's session 1. We discussed the 3 types of vicryl, we discussed Merceline, and we discussed the next one, that was Mersilk, or your silk suture. In the next session, I'm going to have stapler, proline, ethylon, linen, catgut, and lastly the celebrity Statafix, or the barbed sutures. So keep watching, and of course monocril. So keep watching conceptual and keep watching this space. I'm going to be coming next session with even more important sutures. This is Dr. Aditya signing off from part 1 of everything about sutures.